you. Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Thank you to Mr. Nobel Mawunga on the Sign Language Desk. As of Thursday, 17 December 2020, Zimbabwe had recorded over 11,700 confirmed COVID-19 cases, over 9,700 recoveries, 313 deaths, and a case fatality rate of 2.7%. Bulawayo Metropolitan Province and the Matabeleland South Province have the highest number of cases per capita, followed by Harare Metropolitan Province. All provinces recorded new cases this week. In view of the continued rise in new cases, many have asked if the country is going to adjust its public health and social measures. The national response is quite clear and committed to regular program adjustments guided by the situation on the ground and, of course, guided by science. Last week, the WHO, in its global COVID-19 situation update, announced new guidelines on how countries can select, implement, and adjust public health and social measures in line with the various country epidemic situations. WHO also reminded countries that the decision to adapt or adjust public health and social measures must be balanced against the impact that these measures have on the general well-being of individuals and, of course, the communities. WHO also advised countries that the level of COVID-19 transmission in a country is key to coming up with the country's situational level and hence can inform the specific measures that the country can adapt and adopt. According to WHO, COVID-19 transmission in Zimbabwe is currently characterized as Community Transmission Level 2, CT2. This transmission category, assessed together with the country's health system response capacity, has put Zimbabwe in situational level 3. In other words, WHO puts Zimbabwe in situational level 3. WHO at the same time, in its latest guidelines, has outlined the following as some of the additional public health and social measures that countries in situational level 3, like Zimbabwe, can consider when deciding to adjust and hence strengthen the response in the country. Number 1 is closure of non-essential businesses or remote working. They put number 2, people should apply individual precautionary measures and behaviors such as hand hygiene that we talk about a lot, cough etiquette, staying home if unwell, wearing a face mask where appropriate. But of course, for Zimbabwe, this is mandatory in the public, physical distancing, and avoiding crowded places, close contact settings, confined or enclosed places that have got poor ventilation. Point number 3 is child care services. Primary and secondary schools should remain open with adequate safety and surveillance measures in place. According to WHO, continuity of education for children, for their overall well-being, their health, safety should be taken into consideration when considering adjusting our public health and social measures. Number 4, countries in situational level 3, like ourselves, can also consider limiting in-person university teaching and institute or introduce e-learning. This is already also happening. Number 5, evaluate holding sporting and similar events using a risk-based approach. And of course, the final point, number 6, consider countries in level 3, situational level 3, can consider suspending mass gatherings and limiting or decreasing the size of the social gatherings. Once again, Zimbabwe is implementing most of these recommended additional measures that WHO talked about last week. All the gatherings are limited to 100 people or less per gathering. Primary and secondary schools remain open with strong monitoring in place. Remember what we had to do when we identified some outbreaks here and there. Most universities have introduced e-learning services. And finally, the wearing of face masks is mandatory in public places in Zimbabwe. These measures are, however, simply not being strictly adhered to. This is our biggest concern. We cannot talk of introducing additional measures if we're not paying attention to adhering to what we already have. As the festive season approaches, we must work together to strengthen implementation and enforcement of all the recommended preventative measures. These measures are our only solution at this moment. The complacency we continue to witness in our communities truly remains the biggest challenge that we have. It's a big concern. It continues to fuel this pandemic. Let us once again, and I want to emphasize, let us all wear a face mask when in public and make sure it covers both your nose and your mouth. Parties and other gatherings must be limited to 100 people or less per gathering, as mentioned earlier. It is actually better to simply stay away from party gatherings if you can. Remember, you can always have as many get-togethers, gatherings, you name it, as many as you want once the pandemic is over. So last week I promised to come back to you on alleged fake COVID-19 free certificates at our ports of entry, at our borders. Investigations have been conducted and several people were arrested. Several people have been arrested rather. Additional investigations are in progress and the situation is being brought under control, though we are very aware this is a very big challenge. In the meantime, though, monitoring of these ports of entry and support and supervision is continuing. Let me once again remind you that the only current solution to this pandemic is the strict adherence to all the recommended preventative public health and social measures. It is not about adding on measures if we are not implementing or adhering to the ones that are already there. So during this festive season, I urge all of us to stay away from the 3 C's: crowded places, close contact settings, and confined places which have very poor ventilation. Science has demonstrated that these places are COVID-19 super spreaders. We also, once again, in addition to this, we really need to wear a face mask, social distance, frequently wash our hands with soap and running water, or sanitize our hands with an alcohol-based. These measures work. Do stay safe. Have a very Merry Christmas, and thank you so very much for your strong collaboration during the year. Thank you.